Hospital, and I'm going to talk about wound care with the help of Tisha. And so let's start. First, in the handouts, I wanted to talk about the skin specifically to start with, and the layers of the skin, and what do we find from the top of the skin as we go deeper to the bone, what kind of layers we find, and kind of the importance of different things that we're going to find later on when we're talking about the process of healing. Then those different layers become important later on. So the skin is formed by epidermis and the dermis. The epidermis is the superficial layer of the skin. Is composed of five layers. Is avascularized, meaning there is blood supply to that layer. The thickness goes from 0.7 to 0.12 millimeters. It's very thin. And it's composed of keratin and melanin, what gets the color of the skin. Main function is to prevent water loss and repel water and to protect. The dermis, opposite to the epidermis, is really thick, is highly vascularized, and it contains the nerves, the sebaceous glands, hair follicles, and the extracellular matrix. And within the cellular matrix is made up of collagen and elastin, so that's what it gives the flexibility and the elasticity to the skin. Also, it's important because we have I can pronounce this, mast cells and the fibroblast, and those are cells that are going to play a really key role in the process of healing. The function of the dermis is to provide protection and provide a sensation, and of course regulating the temperature in the body. The next layer below the dermis is the subcutaneous tissue, and is composed of adipose tissue and the connective tissue. The thickness depends on what part of the body you are. It depends on the location. Abdominal, of course, is going to be really thick, the subcutaneous tissue, but if you are around the earlobe or the nose or the lateral malleoli, is almost absent. There is nothing there. So later on, thinking about ulcers is really easy to get all the way down to the bone on those parts of the body. The next layer down is the fascia. It's a white, skinny, and covers the muscles and the organs, and it's a three-dimensional. It goes all over the body, is interconnected, and it goes not just below the subcutaneous tissue, but it goes deeper into the organs and deeper into the cells. So between cells there are fascia and connective tissue, and it just goes all over organ cells to very superficial below the subcutaneous tissue. To note here, when the fascia is dead or is no longer in a good condition, it looks gray, and almost, if it's too dry, it looks really black. Then the next level after the fascia is the muscles. We have about 650 muscles in the body. They are red in color, but also when they die, they look really gray and dark. It depends how dry they are. Bone. The important part of the bone is the periosteum. If it's intact, the bone is protected, but if the periosteum is broken, then or in a fracture, then it turns yellow and brown. So that's pretty much about the skin. The important part about the wound healing, there are different stages of wound healing. How, if you have an injury, an open wound, then if there is a full thickness wound, then there is a process that is going to happen on a normal healing. And the first one is the hemostasis, That's the phase that initiates the wound healing cascade. Some people believe that the hemostasis and the inflammatory phase is just one phase. But in this case, we are differentiating because it's where the platelets comes in the picture and they start the clotting process and the aggregation process and start protecting the area. And they form the thrombin and fibrin mesh to protect. The second part is the phase of an inflammatory phase, and it's characterized because we have a lot of redness. It could be very painful, and it lasts between 4 and 6 days in a normal healing. Okay. The idea of this is increase the phagocytosis and remove the debris out of the tissue. Of course, we have edema, heat and pain, and the important part with this inflammatory phase, most of the patients that we see that the wounds are not healing is that phase. They're usually in the inflammatory phase because it's delayed, also the necrotic wounds that phase is way longer. It can last months instead of that period of a week. The next phase in a normal healing process is the proliferative phase. It lasts normally between 4 and 24 days, and usually for wounds that are not infected, like a deep scratches, the whole process go into, they can be completely healed in 2 weeks. The proliferative phase is when we find red granulation tissue and is built with connective tissue. And this is when we see new epithelium appearing from the edges of the wound. The important part here are the fibroblasts, are the cells that produce the collagen to get the proliferation phase going. And the last phase is the maturation phase. It goes between 21 and 2 years. 21 days, I'm sorry. 21 days to 2 years. And the collagen fibers reorganize in a cross-linked fashion and to decrease the tensile strength. The key part is that tissue is when the scar tissue is maturating. It goes from red and hard to when it's completely healed and the maturation tissue is completely finished. It looks white and is flat. The important part here is when it's in the maturation tissue, this red is easy to break down, and it tends to get really dry also. What do we want to accomplish with wound care? The idea or the goal of proper wound care is to achieve a stable wound. A wound that is characterized and well vascularized with a minimal exudate and free of infection. So what we want to do is to provide a moist wound environment. There was a research done in 1962 where they took pigs and created wounds in the skin and did different kind of treatments just to see what is the healing rate and the healing process. And they found out that wounds that they were keeping closed and moist, they were healing way much faster than wounds that they were keeping open to air and dry. So since 1962, the whole concept of dry, keeping the wounds open to air is being changing progressively, and now the whole concept is we want to keep the wound in a regular body temperature and close in to keep the moisture control. We don't want a wound that is wet or draining. We want to keep a wound that is with good, have good moisture. And definitely don't want anything dry because the tissue, the cells work in a really good moist environment in order for them to produce and work. If you keep the tissue dry, it's going to die. So things that we need to consider for wound bed preparation is the tissue management. We need to control that we don't provide, that we stop the wound from progressing. We take care of the tissue around the wound. We need to control the inflammation and the infection control. So we want to make sure that we are cleaning the wound frequently enough that it's going to get rid of any kind of infection. We're going to create a really moisture balance, and we're going to promote that the epithelial cells are going to build from the edges of the wound in. I'm put some websites here. If you guys want more detailed information, you can check about wound research. There are different articles there, very interesting, and different topics about wound care. Tish, turn. Talk about.
I was going to talk to you guys about how to measure a wound and clean it up. I know you guys are eating, but you measure head to toe. That's your length. Side to side is your width. You need to make sure you measure from the top of the wound edge to the bottom of the wound edge, even though your wound may be jagged. That's really important there. You also need to measure out around, they call this the peri area, peri wound bed. Measure out 4 centimeters from that, and you're going to describe what that looks like also. Use normal saline and just flush it out. And if it's draining, don't grab a culture before you clean it. You need to have that wound bed clean, because if it's draining, it's still going to drain. You're still going to get that on the your swabs that you need, but you don't want to add any extra goo into it that didn't need to be there. So then you also need to measure the inside of the wound. So you would take, what we use up here is just the cotton tips. You measure down, find out where it's at, and then grab your measuring tool and write your measurement down. You're going to measure length times width times depth in centimeters. This up here is tunneling, and you're going to measure where it's tunneling at, or if it's undermining. Undermining is a little bit different than tunneling because it goes right underneath the wound edge. That's where tunneling goes down. And when you're documenting that, you're going to look at your wound like it's a clock. And if you've got tunneling at 3 o'clock, you need to document, I got a 1/2 centimeter tunneling noted at 3 o'clock. Or if it's undermining at 5 and 6, you need to make sure you measure that. And measure your entire wound bed, because you have different depths in there.
Do you measure it at a slant, or do you measure it up and down, like those are slanted?
I measure, if it's tunneling, you're going to go in, and you're going to still measure at a slant, because...
Okay.
Is there any questions on that?
I guess, are you measuring like from where the tip is stopped in the tunnel to
Yeah.
the wound edge, or just to the bottom of the bed?
Yeah, wound edge.
So this way.
Okay. I'll wait on that staging pictures. Or do you want to go over staging?
Yeah, I don't have any.
I mean, up on 2 South, we've got measuring tools up there. I mean, if you guys can't find anything, we have all kinds of stuff up here. Go over your case study before I start talking about.
Yeah, we have
staging.
in the handouts. We have the staging of the pressure ulcers.